Let's talk some more about high blood pressure. We mentioned low blood pressure earlier. Low blood pressure um, is generally not a problem as long as you're healthy. People who have a tendency to have low blood pressure, they might get that head rush more easily if they bend down and stand up quickly. But we don't usually worry about low blood pressure, generally speaking. However, what we do, it is a significant and central problem for patients who are hospitalized for serious disease. Now, that could be because they're dehydrated or they have blood loss. Low blood pressure caused by those things is relatively treatable, but low blood pressure happens in all of our seriously sick patients, whether it's a serious pneumonia or a patient who's had a burn injury or a serious trauma from a car accident. But we did talk about that. Let's talk about this problem of hypertension. Hypertension is the medical term for high blood pressure as a chronic disease. Hypertension is a chronic resting blood pressure of, used to be that, but now greater than 130 over 80. Sometimes people say, well, what if your blood pressure is 120 over 90? Is that high blood pressure? And the answer is yes. It is high blood pressure whether this number is too high or that number is too high or both. It doesn't have to be both, okay? Um, and which one's more important? People will ask me. Generally, we think if the diastolic is too high, it's more important. Why? Let me remind you of our discussions of the heart, part of the cardiovascular system, that the higher diastolic pressure is, the greater the afterload is that the heart needs to pump against in order to push out any blood from the heart. In general, hypertension is easily ignored by patients. Your blood pressure, my blood pressure right now could be 140 over 90. I wouldn't know. We don't have a way of sensing that our blood pressure is too high. And that makes it a difficult condition to treat because patients feel okay, at least at the beginning of their hypertension. And yet, sometimes the medications that treat high blood pressure will make us feel tired or, mostly tired. So you can understand that people don't necessarily want to treat their high blood pressure because I feel fine. However, hypertension is called the silent killer for a reason. It will kill you. And once the damage is caused by high blood pressure, there's no going back and fixing that damage. If your aunt or uncle lived with high blood pressure for a long time and then start having the problems that high blood pressure causes, well, we can fix their blood pressure, but that doesn't make the damage go away. Once the damage is done, it's done. And that's why it's so important to treat high blood pressure before it has caused any of the damage. Now, what are the problems that high blood pressure causes? Well, the first problem is that it weakens small arteries. It can cause things called aneurysms, and aneurysms can blow out just like too much pressure inside of an inner tube. So, what's an aneurysm? An aneurysm is a weakened spot in a major artery that is ready to blow out. Imagine if, while I was doing this video, I was pumping up the inner tube of a bicycle tire, right? If I was just inflating it, and at first you just saw it stretch, and then maybe you saw it get a little bit bigger. But if I keep on pumping during the entire video, you might start to feel uncomfortable because you're like, oh, that thing's gonna explode, right? And right before it explodes, what's going to happen? One area of that inner tube is suddenly going to bulge out and it's going to look a lighter gray color. And that's the spot. That's the spot that's about to give. And you would be right. Well, that spot, that gray bulgy spot on the inner tube, is analogous to an aneurysm. And just like the bicycle tire, they can blow out. I'll show you that in a second. But it's not just the big arteries that the ones that develop aneurysms that can blow out. The little tiny blood vessels, they also can be have so much pressure into them that they start to blow out as well. And that will damage any of the tissue that's supposed to be receiving blood from that artery. For example, the retina of your eye, little tiny arteries are bringing blood to all of those cones and rods that are giving you your vision. If the little arteries get too much pressure in and boo, they blow out, then those will be parts of the retina that no longer function for you. So it'll cause blindness. When we get to the kidney, we will talk about how incredibly damaging high blood pressure is for the functioning of the kidney. Blowouts of little tiny arteries in your brain will damage parts of your brain. There goes that memory of the summer of 2010, just like that. It also overworks the heart. And let me again remind you of what high blood pressure does to the heart. High blood pressure increases afterload so that every beat of the heart, 24 hours a day, 7 days a week, can require twice as much effort as it did before and cause the blood to move even less blood per stroke. So all of these are problems that hypertension causes. Okay. Here is a picture of an aneurysm, right? Here is a healthy aorta. Here is an aorta that has had too much pressure inside of it for too long, and now it is an aneurysm. This is that gray spot on an inner tube that's getting ready to blow. If an aortic aneurysm ruptures, then you're unlikely to survive, actually. Even if a patient has a ruptured aortic aneurysm and the moment it ruptures is while the patient is under anesthesia and getting ready to have the surgery to fix it, even then, the patient may not survive. The most common other place where an aneurysm will form is going to be in the arteries, the cerebral arteries, the arteries at the base of the brain. And when those rupture, it will be a profound kind of stroke, a hemorrhagic stroke that is difficult to survive at all, and very, very unlikely that if you survive, you'll survive without permanent neurologic damage. All right, so let's talk a little bit about edema. Edema, and that's how you pronounce that word, edema. I don't know why. Edema is defined as excess fluid in the extravascular compartment. You know, we talk a lot about the fluid that is running through your bloodstream, right? We talked a lot about that. And you know that it's the blood is made out of a cellular fraction, mostly red blood cells, and then it's made out of this liquid part, which is known as plasma. We also talked about how the watery part of the plasma, which is the part of the plasma but not the large proteins, how that stuff filters out at the beginning and jumps back on board at the end. Now let's think about what happens in high blood pressure. With normal blood pressure, a little bit of fluid leaves and almost all of that jumps back in. If you've got high blood pressure, then the blood pressure here is greater. And if the blood pressure here is higher than normal, then more fluid leaves at the beginning. And usually, up until your blood pressure gets quite high, still most of the fluid will come back in at the end. But your blood pressure can get to a point where the fluid that's leaving at the beginning is just so great that very little of it jumps back on board at the end. Now, that fluid is in what's called the extravascular compartment. It is also known as interstitial fluid. Let me print that out for you. Let me print that out. Interstitial fluid. The fluid in the extravascular compartment is very often referred to as interstitial fluid, and that's the fluid between the cells. That is going to constitute edema. Now, this problem, edema, it does happen because of high blood pressure, but that's not the only thing that can cause edema. Edema, when you look at it, you would say, oh, there's swelling there, or your ankle looks swollen, right? That would be that. And it can be caused by blood vessels that are too leaky. When blood vessels are too leaky because of an allergic reaction or because of an inflammatory reaction, like we see with COVID-19, that can cause swelling or edema. It can be because of a decrease in lymphatic return. Remember, the extra fluid that is out there in this compartment, the fluid that does not jump back on board and head back to the heart, that fluid gets returned to the vascular compartment through the lymphatic system. It can be caused by an imbalance of osmosis. If your liver is no longer able to make enough albumin that is creating the osmotic force that's asking the fluid to come back in, then that can also cause edema. But another cause of edema is hypertension. So make sure you know the definition of edema. And an aneurysm. Great. So remember that high blood pressure can cause all of these problems. And high blood pressure or hypertension can be going on and you feel fine. Your patients can walk in with a blood pressure of 150 over 100 and they feel fine. As a matter of fact, when you fix their high blood pressure, they'll complain because they're feeling too tired. So it is a silent killer because while those patients are feeling fine, they are not fine. And the high blood pressure is damaging their arteries, causing blowouts of little tiny arteries that doesn't even get noticed, challenging their heart by increasing the afterload. Hypertension does that. So it's really important that we encourage our patients with high blood pressure to take their medications. How do we control high blood pressure? Well, at the beginning of this set of lectures, I think starting with number 6 or number 5, we learned that blood pressure gets regulated by regulating blood volume, by vascular resistance, and cardiac output, right? These are the 3 ways that blood pressure is controlled by your physiology. And these are the 3 main places where medications that are administered by your doctor can intervene to control high blood pressure. There are categories of drugs that will control high blood pressure just by regulating blood volume. How does that work? That is going to be those categories of drugs called diuretics. Diuretics, D-I-U-R-E-T-I-C-S. Diuretics, they cause your patient to create more urine every day. More urine every day means a lower amount of blood volume. There are entire categories of drugs that change vascular resistance. I'm thinking particularly of drugs like calcium channel blockers that cause your blood vessels to go from the real constricted type, which causes high blood pressure, and causes them to relax, which lowers blood pressure. And then there are entire categories of drugs, several categories of drugs that change cardiac output, that tell your heart, beat a little more slowly. Don't have such a big stroke volume. So we're going to discuss the control of hypertension at the beginning of our next video.